Come on, 2, 3.
Well, good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Thursday, February 17th, 2022. And our top story today, plan for who you are when saving for health expenses. Joining me now to discuss this and a lot more, Carrie Hannon is a journalist with Yahoo Finance. Carrie, great to see you. Thanks so much for joining us on the program this morning.
Yeah, it's great to be here, Jeff. Yeah, I'm now a senior columnist at Yahoo Finance. This is a new opportunity for me, and it's just been fantastic. It's just a wonderful platform and great work they're doing over here.
That's great. Well, that we love Yahoo Finance. We often feature a lot of their content. We're going to talk about some stories you wrote in the past week. Let's talk about health expenses first, Carrie. In reading the article that you wrote for Yahoo Finance, it seems like we really control, when we get to retirement, we have some level of control. We can't control the cost, but we can control what we can control, which is our behavior.
Without question. And that article, that column came out of a conversation with Dr. Carolyn McClanahan, she's a financial advisor with Life Planning Partners is her company. I had to look to check out, make sure I said it right. And she advises her clients, and you and I know this, health expenses are going to be the biggest chunk in many ways of your expenses as a retiree. Estimates are something like 15% of after-tax expenses are going to be towards your medical bills, which is Medicare premiums and out-of-pocket stuff.
Yeah, I mean, it's expensive. I don't know, it borders on the outrageous, but when you look at the things that, the diseases, when you go down the CDC list of the diseases that inflict so many Americans, if you exclude COVID, heart disease, cancer, diabetes, I think those have to be among the top three. You can't necessarily control getting cancer, and you might be predisposed because of your genes, your birth, your parents, your environment. But there are things you can do to ward off and protect yourself and ultimately lower that amount of money that you have to spend out of pocket. Because the last thing you want to do is eat into your retirement savings as a retiree just with healthcare.
Without question. I mean, taking control of a healthy lifestyle way before retirement is going to be your key to success here. And, the report I saw recently when I wrote that column is that 1 in 4 Americans over 65 have diabetes, right? Now, this is something, like you said, you could be predisposed to it, but there are things you can do right now to, build into your lifestyle healthy habits and taking control of these things so that this is one controllable expense to a certain degree that you can embrace today that will really pay off down the road. And that's everything from getting, the way you eat with an eye to nutrition, but also physical exercise. A lot of things you and I have talked about over time.
Yeah, and we don't know how long we're going to live, but you can control these things. And by the way, not only does it reduce your expenses, it improves over time, and the payback is huge, but it increases your fullness of life, your improvement of your overall health. That has mental as well as physical, has a mental and physical impact to you as an individual. Last thing you want to do is spend your retirement years with creaky knees or some of the, going to get dialysis or some other treatment.
Exactly, Jeff. And the thing is, the variables is, a lot of these numbers people throw out. Fidelity does a big study every year or something saying that, have at least $300,000 after tax to cover these kinds of expenses throughout your retirement. And jeepers, that's a lot of money, right? So, but it all depends on person. There's so many variables about, like you just said, crystal balling, how long are you going to live? And what are some of the things that might happen to you? But we do know that there are certain things that we can embrace and take in control of right now. And like you said, it's not just controlling your expenses in retirement and your healthcare expenses, but my goodness, it's your entire life and your mental outlook and your well-being.
Yeah, and I got to tell you, Carrie, ever since we launched this network, I think retirement is a lot more than just the numbers, right? I think that's what you're talking about here in your article for Yahoo Finance, which is, okay, it's the numbers, but there's a lot more than just the end result, which is lowering your cost. Because if you're not healthy mentally or physically, look, you're going to spend those 30, 35 years, 40 years if you're lucky, being really miserable. And you don't want you to be miserable in retirement. You want to be happy. You want to sit with the grandkids. You want to sit with your spouse, your partner. You want to go to baseball games. You want to paint. You want to do things that you haven't necessarily done.
Yeah, and so really, this is the time in your life. As soon as you can start paying attention to this stuff, do, because don't keep kicking it down the road. And there's, in the article too, we mentioned long-term care insurance. There are things that people can do to cover some of these expenses in retirement and later in life, particularly that last decade, which is pretty gruesome and for a lot of people in terms of expenses. But I will say that even today it's super expensive. So it's a gamble of whether you should, even if you get it in your 40s. These policies are changing all the time, so there's new ones coming along, but you don't know what it's going to look like in 20 and 30 years when you might actually need it, right?
Yeah, and that's a whole nother discussion about that, and I want to get to that maybe in a future episode, but I need to take a very quick commercial break now. Carrie, when we come back, we're going to talk about COVID rules when traveling abroad, if you're going to do international travel, and it looks like people are getting ready to travel. Well, you're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you stuck with a low credit score? A credit report and score that's causing you to be denied credit or pay higher interest rates than others for the same things? Then do what Terrence did and call Credit Repaired for your free credit evaluation to help restore your credit.
I started thinking about buying a new house, and my score wasn't where I needed it to be. I called and spoke with one of the representatives, and we just had a good conversation, and I liked what he was saying.
Just one call for his free credit evaluation was all it took to start back on the track to repairing his credit.
I'm seeing the deletions and I'm getting the report, so I know something's being done. It does make a difference to me.
All it takes is one call to get started.
Credit Repair has given me a second chance to have a better credit score.
Don't let a low credit score hold you back another day. Do what Terrence did and make the call for your free credit evaluation.
Call 800-819-4152. That's 800-819-4152. Again, 800-819-4152.
Welcome back. We're talking this morning to Carrie Hannon of Yahoo Finance. Carrie, thanks so much for staying with us this morning.
Great to be here, Jeff. I love talking to you.
Yeah, new affiliation, but same good old Carrie Hannon. We love having her and her expertise. And I mean old in terms of experience. Anyway, that's a slippery
I
slope.
got
I'm not
you,
going
I got
to.
you.
You know what I mean. You know what I mean there, Carrie. All right, let's talk about these. People are planning to take trips. I think people are over the COVID thing. That's just my general anecdotal feedback. Is they want to get back to some level of normalcy, still be protected. But if you're traveling abroad, Carrie, you gotta know the rules of the airlines, the hotels, and the locations you're traveling to.
Without question, the name of the game is patience, right? Patience, patience, and you got to do your homework. And the first bit of sort of overarching advice that people say is, if you have booked an international trip, leave yourself plenty of time for the travel process. You need to, when you used to go to the airport 2 hours ahead of time, go 3 hours. Because there's all sorts of checkpoints to check your documentation for vaccination, for negative tests. And this is where it's important to understand what country you're traveling to, because it's super confusing.
It is super confusing, and I feel like it changes every moment. I mean, as you know, I curate the news every morning, and one of the things I look at is travel. And every day there is a new CDC bulletin, a new bulletin on what what different countries are restricted, what countries are reopening. But Carrie, I think a lot of this centers around you got to still get your COVID test. Some countries require vaccine status, your booster status. You got to be able to prove documentation. You got to quarantine, not quarantine. You mentioned patience. Patience is important here.
It is patience and homework. So what you need to do is, hey, okay, so you got a trip coming up. You've booked yourself to Paris for a 5-day getaway. And who wouldn't want to do that? But first, here's some things. Go to the State Department website and see what's happening in that country, in Paris, in France. What are they saying the restrictions are? Go to the Embassy of France website and see what are they saying up there about their current restrictions and regulations. And finally, go to the CDC website. They tell you exactly what their warnings are for each country. And last time I looked, there were maybe 100 countries on their high risk list. But it's a personal preference how you feel about some of these things. But what is not a personal preference is what the actual regulation restriction is to get into the country and to get out of the country. So go to those websites and really figure out what do you need to have in hand when you get to the airport so that you can safely go through all those checkpoints and those long lines and you can get where you want to go.
Yeah, the rules are the rules, and they unfortunately vary. They're not uniform. Carrie, just a basic travel question. We have seen domestic flights here in the U.S. get canceled because the lack of crews, the lack of airline pilots. The airline industry really ramping back up here, and I know the cruise industry, hotels, airlines hit real hard during COVID, and they're just now getting ramped back up. How important is travel insurance if I'm traveling abroad to if I buy a ticket to make sure that I'm covered in case something that I can't anticipate might happen?
Yeah, Jeff, that's a great question. And again, an individual risk factor. But I think today it's really worth taking a good look at having that travel insurance because, yeah, it's quite possible you're going to have a flight that has been canceled or delayed, or the worst scenario is that you actually test positive before you return it, because you have to have that negative test 24 hours in advance in many countries. I know France, I think, is that way. And so you absolutely, if you get, test positive, then you're going to have a hotel stay. You're going to have a quarantine period. You're going to have to rebook a flight. Some of that stuff's not going to cost you. An airline might be quite good about shifting that for you. But there are some additional expenses that you may incur, meals, all that kind of stuff. Travel insurance can cover you for these kinds of things. Look into the nitty gritty of all that and find out what might be offered right now when you're buying your ticket through the airline and additional coverage you might want to consider. One thing is trip insurance is cover everything, cancel for any reason. I think that's what it's called. And so that's expensive, but that's kind of the gold standard if you're really worried.
Yeah, I mean, now I think of any time I can think of to have travel insurance, if you're one of those 1 in 4 families are thinking of traveling, and if you got kids, I mean, the more people that you travel with in a party, the more potential, more risk I think there is in terms of someone contracting COVID and then spreading it to others. And I think that kind of just raises risks and the qualifications and things to think about. Carrie, you mentioned expenses, and I just want to kind of hit on that. There's a lot of unintended consequences, a lot of unintended expenses should you test positive. You mentioned meals, the hotel, the taxi. You could lose a week of wages at work. I mean, there are a lot of things you really need to factor in that maybe you didn't factor in when you planned in the past.
Yeah, it absolutely is true. And so, take a good look at things. There are some, good airfares. I know cruises, actually, if you're booking for a couple months down the road, they're great deals right now. But all in all, you need to pay attention to some of the extra costs that might come along with really making sure that if you have to have a change of plans, it's not going to really hit you hard in the pocketbook.
Well, I think today was a great show. Really enjoyed the conversation about healthcare and travel. We got a little wellness and lifestyle in. Carrie Haddon, great to see you. Congratulations on the new role with Yahoo Finance. And look, we look forward to having you back on the program again very soon.
Thank you. Take good care.
And that wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to, drop us a line. And don't forget, for all the latest news and developments in lifestyle, finance, tech, wellness, so much more, and all in one place, check out today's edition of our daily newsletter, The Morning Pulse. And hint, it's free. Want to search our archives or see our latest content? Well, check out our website. That's www.broadcastretirementnetwork.com. And of course, our streaming partners like Amazon, Roku, Samsung, and over 100 more. We're back again tomorrow for another edition of BRN AM. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
Waiting here for you to take and drink of. But if you're tired, come on.
Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.
Are you being audited? And do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate your tax bill and reduce your stress. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will work with you using our years of experience to represent your case to help you get the best resolution under the IRS guidelines. Help is here to deal with the IRS to reduce your stress. We've handled thousands of cases, so we know what we're doing. If you owe $10,000 or more in back taxes, do not call the IRS alone. Call a Tax Doctor now for a tax emergency analysis.
Call 800-224-6439.